Good afternoon and welcome to the Alliance for Living. We are the only standalone HIV/AIDS service center in southeastern Connecticut. My name is Kelly Thompson. I'm proud to be the executive director here. Since 1998, we have been providing comprehensive services to improve the health and well-being of people living with HIV in New London County. We do medical case management, housing, a food program. We offer acupuncture and meditation and education. We're scaling up a testing center to begin testing for HIV and Hep C in the next couple of months. So through our work here at Alliance for Living, we are acutely aware of the devastation of substance abuse and the opioid epidemic here in New London County, across our state, and in this country. The bill the governor is signing today comprehensively addresses the prevention of substance abuse and opioid overdoses through education of prescribers, strengthening the state's prescription drug monitoring program, increased access to naloxone by allowing pharmacists to prescribe, and the reorganization of the Alcohol and Drug Policy Council. What is great about this approach is that the responsibility is on all of us to address substance abuse and the potential overdose. Community members, state officials, doctors. It also promotes a paradigm shift from looking at substance abuse as that person's a junkie, an addict, an abuser, but rather seeing them as someone's child, parent, spouse, coworker. And it also lets us reframe the way we see overdose. Rather than an overdose, it's a poisoning. Instead of arrest, we see treatment and recovery as an option. We applaud the efforts of all the legislators that are here, all the advocates, all the doctors, all the law enforcement for promoting and putting this bill, bringing it to fruition. Especially want to thank Governor Malloy, whose forward thinking will save lives and also position Connecticut as a national policy leader in the fight to prevent substance abuse and opioid overdose. Opioid, I need to say that. I am proud to introduce and welcome Governor Dannel Malloy. Thank you.
Hey, listen, it's great to be with everyone. Actually, as I said, we're crawling with commissioners. We have 3 commissioners here. I very much appreciate that, and give them each an opportunity to say a few words. It's great to be here at this center, and I want to thank Kelly, and I want to thank the Alliance for hosting us here today. We know that the eastern portion of the state and the western portion of the state have particular problems, our urban environments included, but non-urban environments as well. And so I thought it was important to get out of Hartford and do something on the road, and we thought that this would be an appropriate place. I'm certainly happy to be joined with so many other elected officials, state representatives, state senators, mayors as well, and to have you here. You know, as of yesterday, the state police have saved at least 34 lives. Maybe it's more. Maybe you're going to update me. Maybe you've gotten up to 35, but 34, I think, is the right count. At least as of yesterday, with 2 treatments yesterday, if I understand it correctly. That's quite amazing. But the downside of all the good things that we're doing is that we're seeing the highest number of fatalities as a result of drug addiction that or drug use that we've seen in a very, very long time, about 300, and that's entirely too high. And what this legislation is a comprehensive, I believe, the most comprehensive that any state has done, although there'll be some more things we want to get done next year. I'll just put you on notice. Because this is part of an overall plan to change our criminal justice system, and quite frankly, our approach to the commission of offenses, how we treat those offenses, and how we keep people as safe as we possibly can. But this is a comprehensive approach, and it's going to require doctors and nurses and pharmacists to do far more work than they were required to do, and do it much more immediately. Instead of loading data in weekly, they have to load data within 24 hours. That is an important tool. We're also looking at how much narcotic is being prescribed at any given time, and what the justification might be for prescribing more than 72 hours worth, for instance. There's not more pain in the United States today, but we're seeing multiples. Some have said well over a 300% increase. Some have said as even higher in the prescribing of these painkillers. There's not more pain, but there's a lot more pain prescriptions, excuse me, going out. And so we need to work with pharmacists. We need to work with doctors. We need to work with everyone to get some control on this thing. You know, it's about 2 years ago when the New England governors got together for the first time. We've had an update on that. We're working with our partners in Canada as well, since we share so much of a border with them. And we thought, my administration and others, and our partners in the legislature and all of the departments and advocates, who I also want to thank for their advocacy, we thought we should come up with a comprehensive way to treat this problem in Connecticut. That's what this legislation is. It is important. It will save lives. It marks a different approach with respect to people who are abusing drugs. You know, Kelly, I'm just going to create, I almost shouted it out, and then if I did that, I'd be like my brother Terry, so I didn't do it, but because he's always shouting things out. But you know what you left out, Kelly? You left out grandparents. The fastest growing abusers of opioid in America are people from 55 on. And you know why? Because they're getting knee replacements and hip replacements, and they're getting hooked. Now, one final thing I want to say about this opioid explosion in particular is heroin is more dangerous than it's ever been, and it's cheaper than it's ever been. So what we end up doing is introducing someone to an opioid, and we're giving them long-term prescriptions for pain, not really knowing how long that pain is going to last in that individual. We're getting them hooked, and then we're pretending we should be surprised that they go and find a cheaper alternative to illegally buying one of the prescriptive drugs. This is a fundamental different approach that we have to take. We're going to take it. We're in the process of building that system. We have lots of people to thank: legislators, commissioners, advocates, and then, quite frankly, Kelly, the reason we're here is you're where the tire hits the road. You're the front line, and we need you to be strengthened and to have the tools necessary to do that. I'm going to give each of my commissioners an opportunity to do I have the wrong order? No, I'm going to give my three commissioners an opportunity. If you would introduce each other in order, that'd be great. But the commissioner, I referred to this. This commissioner and the folks who work for her have saved in excess of 30 lives so far, based on the legislation that we passed a year ago, and which we're strengthening now. Commissioner, go get him.
Yes, sir.
And if I said anything wrong, don't correct me.
So thank you, Governor, for a chance to say a couple words. Enacting this important piece of legislation today is really another significant step forward towards safer communities. And I'm really proud to serve an administration whose support for those who struggle with substance abuse and their families is unwavering. Just adding a little bit to what the governor said, last year there were 558 individuals who died in Connecticut from an accidental intoxication overdose, and 2/3 of them were heroin overdoses. The number of deaths varies by community, but in virtually every town, one or more persons have died of an accidental overdose. It's a problem throughout Connecticut and the country. Public Act 15198 makes it possible for all of us to do more. Amongst its many attributes, this act will strengthen current law by expanding civil and criminal immunity for licensed healthcare professionals who are authorized to prescribe an opioid antidote. And this is important. We need their full support and active participation, especially large organizations such as DESP and other first responder agencies. And with that, I also want to give a shout out to one of the people who helped to make it possible for us to equip troopers, and that's Kathy Maurer, Dr. Maurer, who was generously lent to us from Department of Correction. I warned her this was coming, so she's good. But this bill also expands access to to all the antidotes, such as the naloxone family, by allowing licensed pharmacists to prescribe naloxone at pharmacies. This matters, it really matters, because family and friends are on the front line of first responders, and now the antidote will be more widely available to them. Last year, the governor signed, as he mentioned, Public Act 1461, and that act authorized anyone acting with reasonable care to administer an opioid analgesic, I can never say that, Kathy, I didn't get coached well enough, to a person at risk. When it went into effect last October, we were ready. All three of our academies, POST, which trains the municipal police, and CFA, which trains our career firefighters and our volunteer firefighters, and every state trooper, all 1,200 from the colonel on down. And another shout out we have with us, right here. Right here, where?
Right here.
Okay, Major O'Hara, representing the Eastern Districts. Come on, step forward. At the time, Major O'Hara was also the commandant of our academy, and so he was absolutely instrumental in kickstarting the Narcan training. So, profound gratitude to you as well. And so now 1,200 troopers are trained around the state. Within 6 days of the training of our last trooper last year, we responded to our first service call. Fast forward, as the governor said, less than a year later, and 34, but I'm sure there'll be more, have been revived. Just as he said, just 2 yesterday, just in time for the briefing today. So with today's legislation signed into law, the governor has made it possible for all of us to do more thoughtfully and thoroughly to help those who need it the most. And I want to promise you that, as we have in the past, we will be ready to make the most of this opportunity too. And now, as you asked, I'm very proud to introduce my colleague, Mr. Dannel.
So I have no prepared remarks because I wasn't expecting to speak, but that's okay. I too would like to join the governor and my colleagues in this important legislation that has an impact on the Department of Correction. Roughly 86% of offenders who come into our system have some kind of substance abuse related matter. Some of your clients probably are here with us today. Dr. Malloy stepped up to the plate when vulnerability may exist in terms of the safeguards that were aligned to being able to provide the necessary prescription in order to present it to our troopers and to allow them to fulfill what was needed in a situation, overdose type of scenario, and she was brave to do that. And I'm so proud of your effort to step up to the plate. Governor, oh, my pleasure. Governor Malloy is very big on making sure silos are broken down and agencies work well together. This is an example of agencies working together, from DEMAS, Commissioner Shiro's agency, and the Department of Correction through the good work of our doctor. So I'm very happy to be here today. I look forward to interacting with you this afternoon, and thank you for having us.
Hi, I'm Commissioner Delphin-Rittman from DEMAS, and it's really it's an important event and day that we're gathered here for. This legislation is comprehensive, it's important, it's already saving lives, and so we're really proud about that. It'll create an opportunity to work together across agencies and to come up with creative approaches to continue to address the addiction issues that we see in Connecticut. What we see in Connecticut, we know are challenges nationwide as well. And so this legislation, through its comprehensive approach, will really, again, create opportunities to continue to save lives. And so we thank everybody here that worked on it. We look forward to continuing to work together to again, find creative strategies for advancing this legislation. DEMAS and DCF will be reconvening the Alcohol and Drug Policy Council, and that will again create opportunities for looking at the opioid addiction challenges we have here in Connecticut, and coming up with ways to continue to implement the legislation and address the addiction issues that we have. So thank you everyone for gathering here today, and we look forward to continuing to work with you. Thanks.
Thank you.
One of the people that we have worked closely with, and who's done so much great work and advocacy on behalf of this legislation and others, is Gary Mandel, and I'd like to ask him to say a few words. Thank you.
Governor Malloy, thank you so much for inviting me here and for all the work you've done on behalf of so many in Connecticut. And thank you for having me here and all the legislators and everyone else involved in the state who's been involved with this. This is, as everyone said, tremendous legislation. From what I've seen around the country, this is the best legislation I've seen comprehensively to attack this issue. And I'm so proud to be here today talking about it. Myself, I was born here in Connecticut. I've lived my entire life here and raised my family here. And like many in this state, I have a personal connection to the destruction that addiction can take on one's family and one's life. On October 11th, 2012, October 20th, 2011, in the middle of the night, I received a phone call that's every parent's worst nightmare. My older son, Brian, had died. In the aftermath of his death, in the months that followed, I struggled to make sense of it. And as I researched and learned and reflected, I saw an opportunity to unite millions of Americans around this cause within one organization like they are for other diseases, such as the American Cancer Society for Cancer. 3 years later, I feel blessed in many ways. We've had an impact in many states with many initiatives and already saving lives. And one of those initiatives that we have been very focused on is the number of people that are dying related to an overdose of an opiate, which is prescription painkillers or heroin. It's all the same family. 15 years ago, about 5,000 people died. Last year, 25,000 people died related to opiates, a 5 times increase. And as the governor said, 4 times increase in prescriptions. They're tied. It's one of the issues we've been laser focused on, and in Connecticut, it's been no different. 307 people lost their life last year in Connecticut related to an overdose of an opiate, which is almost double the number of people that died 2 years earlier. Almost double. Now, 4 months after Brian died, let me back up. 4 months before he died, he came home for a visit. We were talking that night on the back porch. His last night at her home. And the conversation turned to addiction. And it turned to stigma and shame. He said, "Dad, a little over 300 years ago, they used to burn women at the stake in Salem, Massachusetts, because they thought women were witches. And then they learned they weren't, and they stopped. Someday people will realize, I just have a disease." Well, the governor and so many people helping him in his administration and state legislators, this is emotional for me. They have granted Brian's wish. They recognize, the governor recognized that addiction is a disease, and this bill signifies it. This bill will save many lives, protect many families from being shattered. In closing, 2 weeks after Brian died, my wife came into my bedroom, our bedroom, and found me crying on the bed. I thanked her for framing the Serenity Prayer and putting it by my nightstand. I told her the only thing that was keeping me alive was reading that first sentence over and over again. God, grant me the serenity to accept the things I cannot change. I know what I can't change. My son won't be coming home. She asked me if I read the second sentence, the courage to change the things you can. Well, Governor Malloy and all the people in his administration around this state in all different positions have the courage to change what they can. They passed legislation in 2012, in 2014, and again in 2015, which is the courage to change the things they can. And when they talk about saving 32 lives, it's a number. I'm a family. I'm human. My son was human. That's a lot of human beings. Thank you.
Getting good at this.
Not a lean process.
No.